morning, Mrs. Sherricks. My name's Leah. I'll be doing your physical assessment today.
Hi, nice to meet you. You can call me Tiffany.
Okay, thank you, Tiffany. Pardon me 1 second while I wash my hands and then we'll get started.
Okay, sounds good.
Okay, we're going to start with a few questions before we do your actual physical assessment, okay?
Okay.
Any trouble moving your head in any direction?
No.
Okay, have you ever had any head or neck trauma?
No.
All right. Any history of neck cancer in your family?
No.
Okay. Any changes in your sleep pattern?
No, other than the fact that I work nights, no.
Well, when you're not working nights, is your sleep pattern regular?
Yes.
Could you describe your typical night of sleep for me?
I usually get about 8 to 9 hours of sleep at
Okay,
night when I'm not working, and then I sleep during the day when I have a shift.
Okay.
So.
And do you feel rested when you're not on the night shift?
Yes, I do.
I know how the night shift goes.
Yeah.
Okay. Any tobacco use or alcohol use?
I do not smoke, but I do drink occasional wine with dinner, things like that.
Any activities that would require a helmet?
I do ride my bikes with the kids, so.
Okay. And everybody wears a helmet?
Everybody does, because I make them wear a helmet, so Mama has to wear a helmet too.
Okay, perfect. Any history of headaches that I should know about?
I have had occasional migraines. I haven't had one in a really long time though.
Okay, could you describe the migraine for me?
Yeah, generally it's I get a little bit of blurry vision sometimes, or my teeth start to ache, and then it kind of goes fully into my head, the top of my forehead, sometimes the back of my head. And I mean it doesn't usually last very long, but.
Okay, do you take any kind of medication for them?
I don't have a prescription. I just take Motrin or Tylenol, and that usually does the trick.
Okay. What makes it worse?
Bright light, so I try to avoid bright light and loud noises.
Okay. Besides the Motrin, does anything make it better?
Yeah, usually I'll just kind of go into a dark room if I can and just lie down. And usually just lying down in the dark helps a lot with the pain medicine.
Okay. On the pain scale, 1 to 10, 10 being the worst, how bad have they gotten?
I mean, they've gotten pretty bad in the past before, maybe 5 at the most, but nothing that if I lie down I can't manage.
Okay. Just a few more questions and then we'll get started.
Okay.
Any difficulty swallowing?
No.
No? Okay. And do you wear sunscreen?
I do.
How often do you wear sunscreen?
It's in my moisturizer, so on my face daily, and then when we go out in the summer, we always have one.
Okay. All right, so the next part of what we're going to do is your physical assessment.
Okay.
I'm going to touch your face, down your neck, but I'll talk to you the whole time and let you know what I'm doing.
Okay.
At any point, if you're uncomfortable or you have pain, please let me know.
Okay.
Okay.
Well, thank you.
Would you mind taking your hair down?
Oh,
for me?
no,
So that I
no.
can look?
Sure. There you go.
If you're like me, once I get it up.
No, it's okay.
Okay. The first thing I'm going to do is I'm just gonna feel your head.
Okay.
Make sure you don't have any lumps or anything you may not have noticed. All right. And now I'm just going to look at your scalp. So I'll try not to mess up your curls.
That's all right. Just don't find anything.
With kids in the house, you don't find any kid stuff?
That's right. That's right.
Okay. If you want to pull that back up, you can. It's up to you.
Thanks.
How old are your kids?
I have 2 boys, 7 and 4.5.
So you're busy.
Very busy.
Okay. Now I'm just going to touch your face.
Okay.
Again, let me know if it hurts or if you're uncomfortable. Any pressure or pain?
No.
No? Okay. Next thing I'm going to do is I'm going to feel your arteries. I'm just going to do it one at a time.
Okay.
Okay. Now I'm going to feel the joint in your jaw. If you could just open for me and shut. And that crunching and popping on the right side, is that always there?
It comes and goes, but usually when I open really wide, it's there. But it doesn't hurt.
So it's not painful. Do you do anything about it, or is it just...
No, I asked my dentist, but they said there was really nothing I could do. So, and it doesn't, because there's no pain.
Okay. Do you wear a mouth guard at night?
No.
No? You don't grind your teeth or anything?
I don't think so. No, I've never noticed that.
But your dentist didn't notice anything?
Right, exactly.
Okay, perfect. Okay. Now I'm just going to work your lymph nodes.
Okay.
So I'm just going to press kind of firm, so let me know if it's uncomfortable.
Okay.
And I'm going to do these one at a time on each side to start. No pain?
No.
checking your lymph nodes because sometimes you can have swelling, which would indicate an infection.
Okay.
So I just want to make sure that you don't have anything going on. Nothing hurts there or anything?
No.
Okay. And this one's a little uncomfortable because I kind of have to press really hard.
Okay, that's fine.
Okay, they don't feel swollen or anything to me.
Oh, great.
And the next thing I'm going to do is I'm going to have you tilt your head back a little bit.
Okay.
Now, can you swallow? Okay, and if you're comfortable like that, if you'll just kind of remain there for me, I'm just going to feel for your trachea and feel for your thyroid, all right?
Okay.
Now, if you could look down for me,
Okay.
chin to chest, and kind of tilt your head to the right. I'm going to push to feel maybe a little uncomfortable and kind of a little strange. Okay. Now, if you could put your chin to your chest for me and remain there. I'm just looking at your spine here. No pain, swelling, tenderness when I touch and feel?
No.
No? All right. Now, if you could tilt your head to the right and the left.
Okay.
Okay, very good. Now, if you could look right and left. If you could just do up and down again for me one more time.
Okay.
Okay, very good. Now this, I'm going to have you follow my pen.
Okay.
So if you could just look, I'm going to start testing your facial nerves.
Okay.
So if you could just follow the pen without moving your head.
Okay.
Okay? Okay, very good. This part gets a little silly, but I promise it's testing all of your nerves. So if you could smile for me. Now, can you frown? Can you raise both eyebrows at one time? Perfect. Stick out your tongue and puff out your cheeks. Okay, very good. You're relaxed. At this time, I didn't find anything to be concerned about.
Okay, great.
So I can sign you off on your assessment. And if you have any questions for me, now's the time to ask.
No, I'm good. Thank you.
Okay, it was very nice to meet you.
Nice to meet you too. Yeah.